Make no mistake, if your dog or cat has a problem with their eye, it can go from being a minor inconvenience and irritation to something really serious that may even compromise their sight in the long run. And today, that's what I'm talking about. I'm talking about a cat who has been given steroid eye drops for a keratitis, and is this appropriate? But before I get into that question, here's the intro.
Welcome to Call the Vet, the show that answers all your dog and cat questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
And so welcome to the 36th episode of Call the Vet. So if we've not met before, I'm Dr. Alex and I'm the veterinarian behind ourpetshealth.com. And my aim is to give you the information that you need by answering your questions so that you can look after your pet to the best of your ability. And that includes keeping them well, keeping them fit and healthy in the first place, or if they're unwell, or if they're injured, or they've got something going on, or you're just wondering about a certain health topic, then finding out the information that you need just so that you can make better informed decisions about how to best take care of your pet. So I'm really grateful that you're here sharing your valuable time with me. And if we are meeting for the first time and you're a new listener, then make sure that you hit that subscribe button so that you don't miss out on any future question. Now, this is obviously an interactive podcast as well, and I'm answering your questions. So if you do have a question about anything to do with your dog or your cat's health, then just head over to callthevet.org and you can submit your question there for an upcoming episode. But the other thing I wanted to mention today before I jump into today's question is actually the release of my calendar for 2020. So this is my new charity calendar. It's the first year that I've done this, so I hope you'll get behind this. And I'm donating 20% of all proceeds to the charity Tree of Life for Animals. So this is a fantastic charity based in rural Rajasthan. So it's just outside a town called Pushkar. And it's actually a place where I was very fortunate to be able to spend a month working and seeing the great work they do, working with street dogs, with population control, with injury management, with anything that comes along, and dealing with all kinds of animals. So from dogs to cats to cows to goats to camels, kind of to monkeys, you name it, they treat it, and they do a fantastic job. So it's a very worthy charity. So if you're interested in this, if you just head over to ourpetshealth.com and you'll see the link in the navigation to calendar, or you can head over to ourpetshealth.com/calendar and that will take you to that. So definitely check that out. Be interested to hear your thoughts and just help me support the great work that the Tree of Life for Animals are doing.
Get your questions answered at callthevet.org.
And so let's jump into today's question, which was asked by Marcy, who wrote in to say, my cat was given steroid eye drops for keratitis. Was this appropriate? So to answer that question, we've got to think of what keratitis is. So it's actually an inflammation of the surface of the eye, so the cornea, which is the clear bits that you're looking through, or light is passing through, if you like. And that can be caused by a number of different things. So in cats, very often there is an underlying herpesvirus infection. And what happens here is that keratitis is actually due to an immune reaction to this virus rather than an infection as such. And that causes the cloudiness and the discoloration that you'll see in the normally clear surface of the eye. But there are other causes as well as herpesvirus for keratitis, and that can be things like trauma, so a knock to the eye. It can be irritation, so just something's got into the eye and it's kind of scratched, or it's chemical and it's irritated. That can definitely cause that. An immune system dysfunction can cause that, so a little bit like the keratitis with herpesvirus is due to the immune system kind of depositing complexes that are opaque rather than clear. Similarly, the immune system can dysfunction. Now, that's more of a thing in dogs. I'm thinking German Shepherds in particular, but it certainly can be something that we see in cats. And then other causes can be an increase in actually the pressure within the eye. So we call that the intraocular pressure, and that results in something called a glaucoma, which is an increase in that intraocular pressure. Dry eye is also another potential cause. Again, that's more of a dog problem, but that's where the tear production isn't quite as much as it needs to be. So the eye becomes dry, that becomes irritating and scratchy. If you wear contact lenses, for example, and your eye kind of gets dry, then you'll know what that feels like. And that can cause this inflammation within the cornea that then results in this keratitis. So what you're going to see if your cat does have keratitis, so there's two forms. And I guess the form that I suspect that Marcy's cat cat had is something called a non-ulcerative keratitis. And what you'll see in these cases is that the surface of the eye is going to become kind of pink and white. You might get chalky, kind of raised lesions. And you may also notice new blood vessels growing over that opaque cornea. And that's the body's attempt to heal, to kind of bring all of the good inflammatory cells and all the healing chemicals that are needed to try and sort out that problem. So those blood vessels are actually a sign that the body is responding. But in keratitis, they can overgrow and they can become part of the problem as well. So are steroid eye drops appropriate for this? Well, the bottom line is yes. It depends on the underlying cause, but so long as there's no ulceration of the cornea, then steroid eye drops are absolutely appropriate, and they are the most common treatment given. So you'll have noticed that when I was talking about the causes, that a lot of it is due to the immune system kind of overreacting or a dysfunction of the immune system. And what steroids do, amongst other things, they have anti-inflammatory properties, and they're especially good at dampening down and reducing an excessive immune response. So an example of that would be allergies as well, or allergic skin disease, where steroid medication was and used to be the kind of the number one treatment that we use. There are different drugs that we use for that now, but it did a great job, and it still does a great job. Yeah, depending on the underlying cause is whether the steroid eye drops are going to be used alone or whether there's going to be other treatment needed, and that other treatment might be oral or injectable steroids if the topical treatment, the eye drops, aren't having as good enough effect as we would like. It could be antiviral medication, for example, if we think that there's a herpesvirus, and again, the steroid eye drops aren't doing the job. Or there might be other medication that's needed, tear replacers, a whole load of different things depending on that underlying cause. So like I say, that is as long as there is no ulcer present. And the way to determine that, the way your vet is going to determine that, is they're going to put some stain in there. So it looks orange when it's applied. So that's a fluorescein stain. But when it's actually in the eye, it looks like a bright fluorescent green stain. And what happens there is if there's a disruption to the surface of the eye, to the surface of that cornea, so if there's an ulcer, then that stain actually sticks to it and shows it up really well. You might think that an ulcer in the eye would be really easy to see just by the kind of with your bare eyes, but actually they can be very subtle and really impossible to see without that staining. So that staining is really important. Without that, I wouldn't be giving steroid eye drops, because there is the potential that if an eye has an ulcer and steroids are given, then that ulcer can get worse. It won't heal. The ulcer will become deeper, and ultimately the eyeball can rupture. So that is clearly something that's really serious. So if there is any hint of an ulcer, then steroid eye drops aren't going to be used, or certainly not going to be used initially while that ulcer is being supported in its healing. Some antibiotic eye drops are going to be used instead. There might be another form of anti-inflammatory used, so a non-steroidal anti-inflammatory eye drop might be used, and that's then going to be monitored to make sure it's improving really well. And then it might be that once everything's healed up nicely, steroid eye drops might then be used depending on what the eye's looking at. So it's really important that we get the diagnosis right. The first step is to knowing whether there is an ulcer there or not, and then the second step is thinking what the underlying cause is. Now, very often, if it's the first time that it's happened, or it's happening really infrequently, we're actually just going to trial treat. So we'll start the steroid eye drops. If it's improving, fantastic, we don't need to do anything else. If it's not improving, then that's when we can maybe do other diagnostic tests, or we can try different treatments. Times when that might not be appropriate is if things are really, really bad, and we're really keen to get that diagnosis first, because it might make a huge difference. Now, if your cat or your dog is on steroid eye drops, then it's really important that you keep a close eye on their progress. So if the discharge is getting worse, if they're developing a thick discharge, if it's getting worse in its consistency, so it's becoming kind of thicker and pussier looking, or if the eye is becoming painful itself. So if the eye was open, but your dog or your cat has started to squint, they started to rub their eye, and it's becoming pretty uncomfortable, then you definitely want to stop those eye drops and get it checked out straight away, because obviously the last thing we want to do is to keep going if there's an ulcer present, which could then get worse and could ultimately result in a rupture of that eyeball and a loss of sight and a loss of the eye, which is something that we clearly want to avoid. Now, if that does happen, and occasionally that will happen with a really severe ulcer, if it's picked up too late, if it comes on really quickly, or maybe say your cat goes missing for a few days and they come back, and that can happen really quickly. So one thing with any kind of eye problem is that they can go from looking kind of pretty mild, not too much of a problem, to really severe over a day or two. So it's very important that we get them checked out quickly. It's very important that we have regular checks to make sure that healing is progressing as we would like. And it's very important, if there is any change, especially any detrimental change to your pet's eye, that you get that checked rather than just waiting till maybe your next revisit appointment, which had been scheduled in a week's time. So definitely keep in touch with your vet. And then if your cat does have keratitis that is caused by herpesvirus, so herpesvirus is something, it's part of the cat flu complex, but it's also the same family of viruses that cause cold sores in us. And if you do suffer from cold sores, you know that once you've had a cold sore, then that herpesvirus is with you for life, and it will flare up at times of stress. And so that's the same thing with cats. Once they've got a herpesvirus, then very often they're going to have that for life. And that may mean that they're going to need ongoing management, either permanently, eye drops all the time, or just at times of stress, you might need to start up that treatment again while everything settles down. And so that's it for me for this episode of the podcast. I hope you found it interesting. It's definitely relevant to you, whether you've got a dog or a cat. Eye problems and eye ulcers are very common issues. And so it's important that you know kind of what to look out for and what may happen if things aren't going to plan, just so that you know kind of when to jump in and when to make an extra visit or an extra call to your vet. And if you've enjoyed today's episode, then make sure that you're subscribed so that you don't miss out on any future episode. And remember to submit your question over at callthevet.org. And then finally, just another plug for my charity calendar. So head over to ourpetshealth.com/calendar, or head over to ourpetshealth.com and you'll see the link in the navigation bar at the top to that calendar. It's going to make a great Christmas present, if I can say the Christmas word, in October. It's going to make a great present for any of your pet-loving friends and family, or obviously it's going to look great in your own kitchen or office. And if you love your pets, which I'm sure you do if you're listening to this, I know you won't be disappointed. But anyway, that's it from me. This is Call the Vet. I'm Dr. Alex, and until next time, take care.
You've been listening to Call the Vet. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show that answers all of your pet questions.